Hello, my name is Reine DuBois, and I'm the Clinical Director here at the Health Lodge in Byron Bay. And I'm excited to put this presentation together for you. It's on intravenous vitamin C therapy, and in particular, high dose intravenous vitamin C in the treatment of cancer. And it's looking at this beautiful research paper that's assessed thousands and thousands of studies and really helped bring together what it is and the role of IV vitamin C in cancer therapy. I would love to acknowledge the traditional owners of the land with which this presentation is being recorded, the Arakwal people of the Bundjalung Nation, and I'd like to pay my respect to elders past, present, and emerging. I'd also like to introduce Dr. Anne-Mary Amber, who's been working as an integrative practitioner for over 30 years. She started her career as a nurse and then went on to become a naturopath and has just recently graduated as a doctor. Anne-Mary Amber has been training doctors and nurses for over 30 years in this modality of intravenous vitamin C and is well read in the power of this incredible treatment that works beautifully integratively in the care of patients with cancer. And I'll just hand over to you.
Yeah, I suppose we, really need to probably talk about, the role of intravenous vitamin C in cancer and how research really started over 50 years ago with a well-known Nobel Prize winning laureate, Linus Pauling, who did some studies, and he actually gave patients with cancer intravenous vitamin C and then continued with oral vitamin C afterwards. What's interesting with many of those patients is that they had better quality of life and they had longevity associated with the intravenous vitamin C. These patients all still died from cancer, but it was noted and it was quite significant. Ongoing research wasn't really able to reproduce those findings. And interestingly, when you actually have a look at some of that follow-up research, which is really important in formulating plans and understanding treatments that work, that we need to review and to be able to replicate those findings. And with those findings not being replicated, vitamin C was seen as intravenously as not necessarily a primary treatment for cancer. But what this paper has done is it actually had a bit more of a review. It's had a look at dozens and dozens and dozens of papers that have been done around intravenous vitamin C and the treatment of cancer. What was really found, and as we can see with this little slide, which is very busy, but it's showing that there's over 150 studies that this particular review looked at. And what they found was that there's more emerging evidence looking at intravenous vitamin C as adjuvant, meaning that when we have a person who has a diagnosis of cancer and they're offered standard treatment of care, then we can actually add intravenous vitamin C as an adjuvant. And a lot of these studies are actually showing that there's some positive benefits with that. So that's very exciting. Basically, the abstract, and so an abstract is just really a sort of a small version of actually the study. And what they're actually sort of suggesting is that there is definitely a role for intravenous vitamin C. It's very hard to sort of go, hey, let's see what IV vitamin C does when treating cancer, when in actual fact it's going to be very difficult to get a population of people with cancer that are not offered standard care and only offered intravenous vitamin C. So the message is really that there's emerging evidence and research in the role of intravenous vitamin C as adjuvant therapy.
And maybe not even ethical. I can imagine something like that wouldn't get through the ethics committee.
Absolutely, absolutely. So what's interesting and what's come out is that we've got some very well-known actions of vitamin C. Vitamin C is part of collagen, so your body is made up of protein, and most of that protein is collagen, and you need vitamin C to maintain the stability of that collagen. It's very important in maintaining the movement of minerals across the gut wall. You have vitamin C as part of the transporter that gets iron into the body. So vitamin C has a big role in being able to help your body absorb minerals and heal. Exactly. It also is very important in the inflammatory cells. So your first line responders need vitamin C for their actions. What this study did and what this review did was it actually found that there's quite a few areas that vitamin C may specifically play a role in fighting cancer cells. This needs more further research, but it's a very exciting area. What we're looking at here is actually being able to show how we've got a lot of preclinical studies where they're looking at the combination of using vitamin C with chemo and radiation and the positive outcomes with reducing oxidative stress, reducing DNA damage, and in actual fact, having a more pro-oxidant, so an antioxidant effect, is quite profound. How that relates to treating the cancer is interesting because it seems as if it's going to support a person's body coping better with the chemo and radiation, having less side effects and better tolerability. So in the end, it's a win-win. Here's more looking at targeted therapies and how, again, we're just seeing improvements in activities which are associated with inflammation. So that we're getting a massive anti-inflammatory effect. We're also, and as I said to you, and how important it is, we need iron for our immune system, and just that being able to increase iron in the body with vitamin C can be supportive for someone who's fighting cancer. What the study is really suggesting is that we know that it's potentially unethical to just do intravenous vitamin C for cancer as a research project, but it's more about going. Its role is established. It's well established. We know it's got some powerful antioxidant, collagen supportive, immune boosting properties, and we want to have more and more input from therapies which they're non-toxic, they're supportive, they're relatively cheap to support our patients, and this is what our patients are asking for, and so therefore it's exciting that we have this research available to us. And that's just a reinforcing those summary
key
findings from the study.
And so the other thing, Anne-Mary, that I do love about this work, and I think why it's important that this information is out there about intravenous vitamin C, is because if you look at integrative medicine, it's not using one thing to try and treat a very complex whole picture. It's using a number of approaches, and I think there's some really nice tools that haven't been made available that we do use in integrative medicine quite regularly that I feel need to be considered in the big picture of patients' health journeys, in particular and especially around cancer.
Look, I totally agree. I mean, the concern is that, we're in a paradigm where, the use of intravenous vitamin C is not a first line recommendation. And the reality is it's often discouraged. But what I want our patients to know is that there is emerging evidence, there is clinical trials of the role of intravenous vitamin C, and we do want that research to support and to inform us of how we move forward. So as I agree, Reine, yes, we're always looking for more tools in our toolkit for our patients,
and this is one.
And this is one of them. Yeah.
Thank you.
Thank you.